5 signs of a heart attack. Seniors often ignore until it's too late. He brushed it off like he always did. Just a little tired, he told his wife when she asked why he'd skipped his morning walk for the 3rd day in a row. At 72, Harold was used to needing more rest than he did in his 40s. That was normal. But this was different. He couldn't finish a simple load of laundry without feeling drained. The stairs he used to climb with ease now felt like a mountain. After breakfast, he'd sit down just for a minute and wake up 2 hours later, still feeling worn out. But he wasn't in pain, so he figured it couldn't be anything serious. Maybe he just needed more sleep. Maybe he was getting lazy. He never imagined his heart might be trying to send him a warning. Stories like Harold's are far too common. The signs of a heart attack don't always arrive with a dramatic chest clutch or a sudden collapse. Especially for seniors, they can show up quietly. So quietly, in fact, that they often get mistaken for everyday fatigue, indigestion, or just getting older. And that's what makes them dangerous, because by the time someone realizes something's truly wrong, it may already be too late. In today's video, we're going to walk you through 5 commonly ignored signs of a heart attack that older adults should never brush off. These are subtle, sneaky symptoms that don't always look or feel the way you'd expect, but recognizing them early can make the difference between getting help in time or facing serious consequences. It's not about fear. It's about being informed, listening to your body, and knowing when to act. Before we get into the first sign, tell us where you're watching from. We love seeing your comments, and yes, we read every single one. And if you haven't already, make sure you hit the subscribe button so you never miss one of our senior-focused health videos. We're here to help you stay informed, strong, and independent. Now let's get into the first, and possibly most common, sign that something could be wrong with your heart. Sign number 1, unusual fatigue. Fatigue is a natural part of life, especially as we age. But there's a difference between feeling a bit tired after a long day and a kind of exhaustion that lingers no matter what you do. Heart-related fatigue is not your usual, "I didn't sleep well last night" kind of tired. It's deeper, it's more persistent, and it doesn't go away with a nap, a snack, or a good night's rest. For many seniors, this is the first warning sign the heart sends, but it's easy to miss because it comes on gradually. One day, you're doing your regular morning routine without a problem. A week later, the same routine leaves you needing to sit down halfway through. Tasks that were once second nature, like vacuuming, walking to the mailbox, or even standing at the sink, suddenly feel like they take too much out of you. You find yourself canceling plans more often. You start taking the elevator instead of the stairs, even for one floor. You don't feel sick exactly. You just feel like you're constantly running low on energy. What makes this kind of fatigue different from normal aging is how it behaves. It tends to hit hardest during the day when you're active. You might wake up feeling okay, but the moment you try to do something physical, your body resists. And that resistance doesn't feel like muscle soreness. It feels like your entire system is dragging, like someone turned down the power. The reason? Your heart might be struggling to pump blood efficiently. When the heart's workload increases, like during mild activity or even stress, it needs to move more blood to keep up. But if your arteries are narrowed or your heart muscle is weakening, that delivery system breaks down. Less oxygen reaches your muscles and your brain. The result is that drained, washed-out feeling that no amount of rest seems to fix. It's important to understand that this fatigue doesn't always come with other classic symptoms. You might not feel chest pain. You might not even feel short of breath, yet. And that's why it's so often ignored. Seniors especially tend to dismiss it as just part of getting older. But the difference is that this fatigue feels off. It doesn't feel earned. It feels unnatural, like your body is working harder than it should just to get through the day. In fact, studies have shown that unusual fatigue is one of the most common early signs of a heart attack, especially in older adults and women. But because it doesn't raise immediate alarms, people don't seek help. They assume it will pass. They wait. And sometimes they wait too long. If you've been experiencing this kind of persistent tiredness for several days, or even weeks, it's time to talk to a healthcare provider. They may check your heart with an electrocardiogram, blood tests, or imaging to see if it's working as it should. Even if it turns out to be nothing serious, ruling out heart-related fatigue is a step toward better peace of mind. What you shouldn't do is keep pushing through it, hoping it'll go away on its own. If you feel like your energy is fading faster than it should, or like your body is struggling to keep up with even basic tasks, don't assume it's just age. Don't assume it's laziness. And definitely don't assume it'll get better without attention. Your body speaks to you in whispers before it starts shouting. This kind of fatigue is one of those whispers. Let's recap. Unusual fatigue that feels heavy, persistent, and doesn't improve with rest may be an early warning sign that your heart is under stress. If you've been feeling this way, it's worth checking in with your doctor. Don't wait for more dramatic symptoms to show up. Your body might already be telling you everything you need to know. Sign number 2, shortness of breath. Shortness of breath is one of the most commonly overlooked signs of a heart attack, particularly in seniors. What makes it so easy to miss is how ordinary it can feel. It doesn't always come with chest pain. There might be no pressure, no tightness, just a gradual feeling that breathing is harder than it used to be. That's why so many older adults write it off as nothing more than aging or being a little out of shape. But here's the truth. If your heart is struggling, your lungs often have to pick up the slack. When your heart can't pump blood efficiently, oxygen doesn't reach your muscles and organs the way it should. This creates a mismatch between what your body needs and what your lungs are delivering. The result is breathlessness, even when you're doing something simple like standing from a chair, making the bed, or walking across the room. It's important to pay attention to how this symptom behaves. Breathlessness that lingers or comes on quickly, especially with little exertion, may be a sign that your heart isn't circulating blood the way it should. You may feel like you're out of breath for no clear reason. And while it might not feel dramatic, it's often the body's way of saying that the cardiovascular system is under stress. Another clue is when this shortness of breath appears during rest or while lying down. Some people feel the need to sleep sitting up or propped up on several pillows because lying flat makes them feel like they can't breathe. Others might wake up in the middle of the night gasping for air or coughing. This could be a sign of fluid backing up in the lungs, a hallmark of congestive heart failure or a weakened heart muscle. It's not just about what you feel, it's about how often you feel it. If you're short of breath doing tasks you used to handle with ease, or if you find yourself avoiding movement because it's become too tiring, don't assume it's just because you're getting older. These changes, especially when they happen over weeks or months, could be subtle signals that your heart is in trouble. The danger here is that many seniors naturally slow down their routines over time. So when something like shortness of breath happens, they gradually adjust to it rather than address it. They stop walking as far. They sit down more often. They avoid outings that require effort. Without realizing it, they begin adapting their life around a symptom that should be taken seriously. If this sounds familiar, it's a good idea to talk to a healthcare provider. Your doctor may check your heart function with simple tests like an EKG, an echocardiogram, or blood work to assess heart strain. In some cases, shortness of breath can also be caused by other conditions like lung disease or anemia, but it should never be ignored, especially when it comes on suddenly or worsens without explanation. Again, shortness of breath, especially when it occurs without exertion or without chest pain, may be a sign that your heart is struggling to keep up. Don't assume it's just aging. Get it checked. Sign number 3, nausea or stomach discomfort. Many people think of a heart attack as something that affects only the chest, but sometimes it shows up in your stomach first. In fact, nausea, indigestion, and stomach pain can all be warning signs of a heart attack, especially in seniors and women. This symptom is one of the most misinterpreted because it mimics so many harmless conditions. You might think it's something you ate, acid reflux, or a stomach bug. But when your heart is in distress, it can send pain signals to the abdomen and confuse the picture. This type of discomfort often feels like pressure, bloating, fullness, or queasiness. It may come and go, or it might linger for hours. Some people experience it as a dull, nagging ache in the upper belly. Others feel sharp cramps or sudden waves of nausea that don't lead to vomiting. The lack of vomiting can be misleading and cause people to dismiss the symptom as something mild. But what's really happening is a problem with blood flow. When your heart isn't pumping properly, the digestive system doesn't get enough oxygen-rich blood. The stomach becomes stressed, and that can lead to nausea or even feelings of heartburn. In fact, some people report that their heart attack felt exactly like indigestion, burning in the chest or upper abdomen, sometimes accompanied by burping or discomfort after eating. That's why it's so often mistaken for a digestive issue. The key to recognizing this as a heart-related problem is looking at when it occurs and what comes with it. Nausea that appears alongside lightheadedness, sweating, fatigue, or shortness of breath is much more likely to be related to the heart. Also, if you feel nauseated without any food triggers, or if the feeling comes on suddenly and without a clear cause, that's another sign to pay attention. This symptom can also be more pronounced in the morning. Some people wake up with an upset stomach and think they just didn't sleep well, or that their dinner didn't agree with them. But if the discomfort doesn't ease quickly, or comes with a feeling of unease or anxiety, it's worth taking seriously. Women, in particular, are more likely than men to experience heart-related symptoms in the stomach and upper abdomen. That's why heart attacks in women are sometimes missed or misdiagnosed. Their symptoms don't always follow the standard path. For women over 60, especially those with diabetes or high blood pressure, unexplained stomach discomfort could be a critical clue that something is wrong with the heart. It's also important to listen to how your body feels overall. Nausea paired with cold sweats, pain in the back or jaw, or a sudden drop in energy can point to a larger cardiovascular issue. Even if vomiting isn't present, The presence of multiple subtle symptoms, especially when they feel out of the ordinary, should be treated as a red flag. Don't wait for the feeling to get worse. If you've had nausea for several hours, or if it's paired with other symptoms we've discussed, get checked right away. Heart attacks don't always hit hard. They often start soft, and this is one of the softest places they show up. Let's go over it again. Nausea or stomach discomfort that feels like indigestion comes without warning, or is paired with other symptoms may be an early sign of a heart attack, especially in seniors and women. Sign number 4, neck, jaw, or back pain. One of the most misunderstood symptoms of a heart attack is pain that doesn't appear in the chest at all. Most people imagine a dramatic moment, someone clutching their chest, collapsing in pain. But the reality is often very different, especially for seniors. In many cases, the pain from a heart attack shows up in the neck, jaw, or back, places most people would never connect to their heart. And that's exactly why this sign gets ignored far too often. Heart attack pain doesn't always follow the same path. While chest discomfort is common, referred pain, pain that originates in one part of the body but is felt in another, is just as real and just as serious. When your heart is under stress or losing oxygen, it sends out distress signals through your nervous system. These signals can travel along nerve pathways that connect to the neck, jaw, or upper back, creating strange sensations that don't feel like they're coming from the chest at all. For seniors, this can be especially confusing. Neck pain might feel like stiffness or soreness from sleeping the wrong way. Jaw pain may be mistaken for dental issues or tension. And back pain can be chalked up to arthritis or age-related aches. All of these are common on their own, which is what makes them such dangerous distractions. The key is to notice when the pain shows up, how intense it is, and whether it feels different from your normal discomfort. Heart-related pain in these areas often feels more like pressure, tightness, or burning rather than a sharp or stabbing sensation. It may come on suddenly or build gradually. Some people describe it as a band tightening across their upper back, a dull ache at the base of the neck, or a heaviness in the jaw that radiates toward the ear. These sensations might come and go or persist without relief. They may not be triggered by movement or position, which separates them from more familiar musculoskeletal pain. Women, in particular, are more likely to experience jaw, neck, and back pain during a heart attack. Multiple studies have shown that women often have heart attack symptoms that are less typical and more easily dismissed. That's why older women in particular must pay close attention to discomfort that feels unfamiliar or out of place, even if it's not dramatic. This kind of pain may also occur alongside other subtle symptoms. For example, you might feel a little short of breath, slightly nauseated, or unusually tired at the same time. You may start sweating or feel lightheaded. Taken on their own, each of these could be dismissed, but together they create a pattern that should never be ignored. If neck, jaw, or back pain strikes suddenly and feels intense, or if it occurs with any of the other signs we've covered, don't wait to see if it goes away. Time is critical in a heart attack. The longer the heart goes without oxygen, the more permanent damage can be done. Getting help quickly can save your heart, your brain, and your life. It's also important to know that this type of pain isn't always on the left side of the body. While many people associate heart problems with left-sided pain, referred pain can appear on the right, the center, or even move between areas. Some describe it as radiating or spreading pain, while others feel it in a very specific spot. Either way, if it doesn't feel normal, it deserves attention. And don't assume that pain must be severe to matter. Some people report only a mild, nagging ache that persisted for hours or even days before they finally went in for evaluation, only to find out they'd had a minor heart attack. That kind of slow onset can trick you into waiting it out, but waiting could mean missing your window to prevent something more serious. The most important thing you can do is listen to your body. You know you're normal. You know how your neck and back usually feel when you wake up or after a long day. But if something feels different, if it starts for no reason, if it doesn't ease with rest or stretching, if it comes with strange pressure or a sense of unease, it's time to speak to your doctor or get checked right away. Another helpful tip: if the pain increases with exertion and decreases with rest, that could be a sign that your heart is involved. For example, if walking causes your upper back to tighten or your jaw to ache, but resting relieves it, that's a classic pattern seen in angina, a warning sign of reduced blood flow to the heart. The brain doesn't always pinpoint pain with perfect accuracy. That's why it's your job to connect the dots. No one knows your body better than you do, and your instincts matter. If something feels wrong, even if it doesn't scream heart problem, don't be afraid to get it checked. It's always better to be cautious than to ignore a signal your body is trying to send. Here's something to consider. How many times have you felt neck stiffness or back tension and brushed it off? How many times have you assumed it was just age or just stress? If you're over 60 and these symptoms are new, more intense, or paired with even mild fatigue or breathlessness, don't delay. It could be nothing, or it could be the most important early warning you'll ever receive. To bring it all together, pain in the neck, jaw, or back that feels like pressure, tightness, or burning, especially when new or unexplained, may be your heart asking for help. Listen closely and act quickly. Sign number 5, feeling lightheaded or dizzy. Lightheadedness is one of those symptoms that's easy to ignore until it isn't. It may come on when you stand up too fast or after you've been walking for a while. Some people feel a little woozy, like the room tilts for just a second. Others describe it as a floating sensation or a sudden wave of lightness in the head. But what many people don't realize, especially seniors, is that this seemingly small feeling can be one of the body's earliest alarms for heart trouble. Dizziness or lightheadedness can happen when the heart isn't pumping enough blood to the brain. The brain is extremely sensitive to changes in blood flow, and if it doesn't receive the oxygen and nutrients it needs, even for a few seconds, it lets you know fast. In those moments, you may feel faint, disoriented, or even confused. Sometimes, it gets severe enough to cause actual fainting, but often, it's mild enough to brush off, especially if it passes quickly. For seniors, this symptom is especially important to pay attention to. As we age, our circulatory system naturally becomes less efficient. Blood vessels may narrow, the heart muscle may weaken, and medications can further complicate the picture. Many older adults take blood pressure medications or diuretics, both of which can lower blood pressure or shift fluid levels in the body. When that happens, even a small dip in pressure can make you feel dizzy. But that doesn't mean dizziness is normal or safe. One reason the symptom often gets overlooked is that it can show up during totally harmless activities. You might feel it while standing from a seated position. You might feel it bending over to pick something up. Or it could strike when you're simply resting, reading, watching TV, or sitting at the table. And because there's no chest pain, shortness of breath, or dramatic signal, many seniors chalk it up to fatigue, dehydration, or just one of those things. But here's the danger. If your heart is not supplying consistent blood flow, dizziness is one of the first signs. It's the body's way of telling you something is out of balance. The longer that imbalance goes unchecked, the more stress your heart and brain experience, and that increases the risk for serious complications. It's also important to know that heart-related dizziness may be accompanied by other subtle symptoms. For example, you might feel sweaty or clammy. Your vision might blur for a second, or you might have difficulty focusing your thoughts. Some people say it feels like they're going to black out, while others describe a sudden need to sit down. These signals are your body's protective mechanisms. They're trying to keep you safe by slowing you down. And here's another critical point. Dizziness is not always caused by low blood pressure alone. In some cases, it can be a sign of arrhythmia or irregular heartbeat. When your heart doesn't beat properly, it can interrupt blood flow to the brain in sudden, unpredictable ways. These rhythm disturbances can be brief and hard to catch, but they can also lead to fainting, confusion, or even falls. That's why any new or worsening episodes of dizziness deserve a conversation with your doctor. There's also an emotional impact to this symptom. Many seniors who experience frequent dizziness begin to fear movement. They avoid walking, limit their time outside, or skip activities they used to enjoy because they're afraid of falling. This reduced mobility can lead to further health problems, loss of strength, isolation, and even depression. All of that from something that might be dismissed as just a little dizziness. The good news is that this sign is very treatable once the cause is identified. If it's related to heart health, medication adjustments, hydration, diet, or physical therapy may help. Sometimes, simply standing more slowly or eating more regular meals can stabilize blood flow and reduce episodes. But those solutions only come after someone speaks up about the symptom. It's not weakness to bring up dizziness with your healthcare provider. It's not overreacting. It's being proactive. You deserve to feel steady, safe, and confident when you move through your day. If you've been feeling off balance, even just now and then, it's time to look a little deeper. Now take a quiet moment with yourself. Have you felt any of the signs we've discussed so far and brushed them off? Maybe you thought you were just tired. Maybe you figured it was your age. Maybe you even thought, it's not bad enough to go to the doctor. But heart attack symptoms don't always show up with blaring sirens. More often, they arrive as whispers, a strange kind of tiredness, a little pressure in the back, a moment of dizziness that catches you off guard. If these moments have been happening more than once, your body may be trying to tell you something. The truth is, getting checked doesn't make you dramatic. It makes you smart. It's not weakness, it's wisdom. Listening to your body and taking early action is one of the strongest things you can do for yourself. You're not wasting anyone's time by bringing up your concerns. In fact, you might be saving your own life. A heart attack rarely announces itself with a loud knock at the door. More often, it's a series of subtle nudges. Your job is to notice those nudges and act on them before they grow louder. To put it plainly, dizziness or lightheadedness is not just a passing moment. Especially for seniors, it could be one of the body's first warnings that the heart needs attention. Bonus sign: sudden cold sweats or clamminess. Cold sweats may not sound like a big deal, especially if they pass quickly or don't come with any pain. But when it comes to heart attacks, sudden sweating that feels cold or clammy can be a red flag, especially when it happens out of nowhere and without exertion. This kind of sweat isn't the kind that comes from a hot room or a brisk walk. It's often described as a wave that hits unexpectedly. You might feel chilled, sticky, or notice your clothes damp even though you haven't been moving much. Sometimes it's accompanied by a feeling of anxiety or dread, a sensation that something's wrong, even if you can't pinpoint what. Cold sweats occur because your nervous system is responding to stress inside the body. If the heart isn't getting enough oxygen or blood flow, the body may trigger a fight or flight response. That's your body's built-in alarm system, and sweating is part of it. The problem is, many seniors chalk this up to a hot flash, nerves, or simply feeling off. If you suddenly break into a cold sweat, especially if it comes with fatigue, nausea, lightheadedness, or pressure in the upper body, it's time to take it seriously. These silent signs can often point to a heart in distress. To lock it in, cold, clammy sweats that appear suddenly and without reason may signal that your heart is struggling, and they should never be ignored. Now that you've seen all 6 signs, let's bring everything together. Heart attacks don't always start with chest pain or dramatic moments. Especially in seniors, they often begin with subtle symptoms that whisper instead of shout. Knowing these quieter signs can help you act early, get checked, and possibly prevent something life-threatening. We started with unusual fatigue, a kind of exhaustion that lingers, no matter how much rest you get. It's a sign your heart may not be keeping up with your body's needs. Next, we talked about shortness of breath, even during mild activity or while resting. If your breathing feels labored or shallow without a clear cause, it could be your heart struggling to circulate blood efficiently. Then there was nausea or stomach discomfort, a sign many mistake for indigestion or a minor stomach bug. But when your heart is under stress, it can trigger discomfort in the upper abdomen. After that came pain in the neck, jaw, or back, often missed because it doesn't feel like heart pain. Yet this referred pain is especially common in older adults and women. The 5th sign was feeling lightheaded or dizzy. A sudden wave of unsteadiness or disorientation could mean your brain isn't getting enough oxygen, a possible sign of heart dysfunction. And finally, we covered the bonus sign: cold sweats or clammy skin. If you break out in a cold sweat without activity or heat, your body may be reacting to internal stress on the heart. Knowing these signs helps you stay one step ahead. You don't have to panic, but you do have to pay attention. Your body is always talking to you. The question is, are you listening? So, which of these signs surprised you the most? Drop it in the comments. We read every single one, and your experience might help someone else recognize the signs in themselves. And if this video helped you feel more informed or confident, be sure to subscribe for more life-saving tips made specifically for older adults. Your health matters, and knowledge is one of the best tools you have to protect it.